A fifth case of monkeypox has been detected in the country. The patient had travelled to the Netherlands and Spain. Minister of Health Joe Phaahla revealed this in a briefing today. There are currently no vaccines against the disease, but the minister says scientists believe there is no need for mass vaccination at this point. Let's bring him into the conversation. He joins me now via Zoom from Midrand. Minister, thank you so much for speaking to us this evening. So, as a fifth case of monkeypox is identified in the country today, give us some insights into what your department is looking to do next in terms of the next steps. So I don't think containment is really a word that we need to be using at this stage, but what should South Africans be concerned about, if so?
Well, we need to thank you very much for the opportunity to update the country again. As we said this morning, between ourselves, our clinicians on the ground, our general practitioners, our clinics and our hospitals, at this stage, what we are saying is that we encourage South Africans to be aware of the fact that monkeypox is in our midst. At this stage, we have not yet found it to be endemic in the country. In other words, there is not as yet what we would regard as a local spread. The 5 cases which have been confirmed through clinical and laboratory tests thus far have been associated with some form of traveling, although maybe just to say the first one there wasn't any clear history of traveling, but there was, in terms of the contact tracing, a suspicion that he had been in touch with somebody who had been traveling. But at this stage, it's really to contain once somebody has got the symptoms, the fever, the blisters, kind of rash, which are characteristic, very close to chickenpox. People should get to the nearest health facility where samples can be taken for testing, so that the person can then be isolated. Now, beyond that, if the person is at risk, because what is problematic is somebody who's immunosuppressed. Immunosuppression can come from infectious diseases like HIV and AIDS and cancer treatment. In that case, then the person has to be protected against opportunistic infections. So those are the things which we need to look after. But beyond that, we are saying that we are working with our vaccination ministerial advisory committee of experts, and also following up with the South African Health Regulatory Authority, so that if the cases start to increase, we can then start to invite the people who are at risk, especially those also with immunosuppression, to come forward to be vaccinated, because the vaccines are there. It's just that at this stage, there is no general access because they're still very limited. But we're working with those authorities to make sure that as vaccines become more and more available through the correct channels, we can also access them.
In the wake of the lifting of many international travel bans post-COVID-19, South Africans have joined the world in gladly travelling overseas. Are there any travel advisories that you would issue to South Africans at this stage, given the fact that all the cases so far have involved some measure of travel?
It's premature at this stage to even think about that, because as we have indicated, the cases are few and far in between. Even in the countries in Europe and Americas where there are significant numbers, if you look at compared to the disease like COVID, which has a different mode of spread, including droplets, aerosol spread, touching surfaces, which is much more highly transmissible. And that's why countries were getting quite alarmed, especially when there were variants which were, said to be from the scientific, explanation that they were highly transmissible, like the time when our scientists discovered the Omicron variant. But in this case, transmissibility in itself, it's very low, because it's got to be direct contact with an infected person, or materials like clothing and other kind of garments which the particular person who's infected would have used or touched. So the transmissibility itself is still low. That's why worldwide, after about 4 months now, from May up to now, there's only just over 28,000 worldwide. So the transmissibility in itself is not a very serious burden in as far as traveling. But we also know that even with a highly transmissible disease like COVID, everyone, WHO has advised even about not imposing travel restrictions. And in as far as monkeypox itself, at this stage, we want to assure South Africans that it's just a matter of people who are at high risk. In terms of, as you know, I know it's not a very comfortable description, but the fact of the matter is that over 90% of those who have tested positive thus far have been men, and in the category of men who have sex with men, and therefore, and people who are immunosuppressed. So in that category of citizens, we would say that if you're traveling to countries in Europe and Americas, you have to take extra precautions, but definitely nowhere close to any travel alert. People must continue to travel.
So we know that in usual cases, monkeypox resolves by itself or with care over a period of time. Can you give us an update on the condition of those 4 patients identified prior to this 5th case today?
All the cases have, after confirmation, none of them got seriously ill. There were no complications. It was just, the fever, the skin lesions, and so managing the symptoms, isolating for the 3 weeks to make sure that they don't get into close contact with other people. So there's not been any complications. The 4th one amongst those was a foreign citizen from Switzerland, the one who was confirmed while on holiday in Limpopo. That person, recovered and has even left the country. The 3 who are citizens as well have recovered, and even the 5th one, at the present moment, even though the diagnosis was only made 2 days ago on the 17th, the patient is not having any complications except just, the basic symptoms, signs and symptoms, fever and the skin lesions. So at this stage, amongst the 4 who are citizens and the 1 who was the foreign citizen, none of them has exhibited any serious complications. You remember that even as the WHO reported 11 deaths, most of those were in the endemic areas of West Africa. And I think about only 2 or so were in Europe and America. So the fatality rate is also very low. So at this stage, complications are few and restricted largely to people who may have other immunocompromising illnesses.
Well, thank you very much for that update. Health Minister Joe Phaahla giving us a sense of the situation with regard to monkeypox in South Africa after a 5th case was identified.